back in because electrolytes in it. But you have to call a doctor. Because if you keep pumping this patient's stomach full of feed and it's not digesting, it's going to do what? It's going to back up. So if you get a full syringe, usually they have 100 mil syringe. If you get 60 to 100 mils of tube feeding, and the last time it's been checked in 4 to 8 hours, they're not digesting it. So you call a physician and he's going to say stop the tube feeding for 3 hours and recheck it. Sometimes when you recheck it, it's gone. Sometimes it's still sitting there and they'll stop the tube feeding for so many days, and then they may put the patient on another type of feeding that they think they can digest. But you want to check residual and check placement. Too much feeding, they can't keep getting it because it'll back up. Okay? So we check that and we got gastric contents and we put it back in there. This patient is going to suction. And so you already have that set up. If you're going to do it, you're going to have this tubing and that canister I talked about and all that's going to be hooked to that. And you're going to already have that set up and you're going to connect it and turn it to lower intermittent suction. And it's going to start suctioning the gastric contents or whether they try to, what they do with a bowel obstruction, y'all, instead of going in the bowel doing surgery, they put saline something in. And they hope that the suction will break that stool up and it'll pull out and they don't have to do surgery. That's how they start trying to treat a bowel obstruction. If they can't get rid of the obstruction, that way they take them to surgery. But that's the first way they try to get rid of a bowel obstruction. Okay? So you got, that's the suction. Okay, but if you putting the tube in for tube feeding, which is usually that tube I showed y'all, or not one that's a Salem sump, like I said, this is really to pull out gastric contents. But they will put tube feeding in this tube. You can use it for that. Your other tubes without this air vent are strictly tube feeding tubes. Okay? And it's multiple kinds. Okay. If this was for tube feeding, especially the one I showed you with the black tip on the end, it's got a guide wire in it. You do not put tube feeding to that until they go do an x-ray. You call them or order it on the computer depending on which system, hospital system you're in. And they come in. If the patient can't leave the room or they really sick, they do a portable x-ray of the abdomen. If they can leave, they send transportation to get them and take them to x-ray. And then they'll call and ask the secretary what nurse has the patient in room 204. They get you to the phone and they'll say, tube is in place, you can start the tube feeding, or they'll say it's not in the stomach, it's about an inch above it, push it down and call us back, and we'll check again. So once you verify that it's in place your way and their way, then you can start tube feeding or whatever. If it's the suction, you go ahead and hook this to suction if you got the placement checked. But now we know that's in place, so now we got to permanently take that because we don't want that to slip out this patient's stomach and start backing up. So now we got that. Like I said, the hospitals have a holder for these tubes that don't cause as much skin breakdown as regular tape. But if they don't have tape, you got these two edges on there. What I usually do is take one edge and I come as close to the nose as I can get and wrap that around. You got to get used to doing this with gloves on. Okay, now I'm going to take the other piece of tape and do the same right on top of the other tape. Okay, right on top. Okay, and to make sure, just to give it some extra support, I'll put another piece of tape, but it's going to be real small, just enough to anchor this, so this, if this gets loose, this won't come out. And you put that on there. But like I said, they have some special holders now that you can put on. Now, we got that hooked in, that's in the patient, and we got our suction hooked up, or we're going to wait on our x-ray for tube feeding. It can have multiple purposes. You just got to work on which purpose you have. Now, since we've done that, we're going to let the patient head down a little bit. Not if we got them up too high, or if they comfortable sitting like that, let them sit like that. And we're going to either put this to suction or start a tube feeding when it applies, or either if we waiting on the physician to make his mind up about tube feeding, this is just to gravity with nothing on it, just a clamp clamped off until he gives us an order. All those things can happen. Okay.
How do you pin it to the down?
Oh, thank you so much. Guys, rubber band and safety pin, which we'll get in here. We just couldn't find any today. The safety pins have to be big enough. It's a medium-sized safety pin, and you just put it around the tube. All that's doing is when the patient